But how has the government fared since the lockdown began? A group of academics have come together to complete the first academic review of government's COVID-19 response. Professor William Gumede is one of the 13 experts. He joins me now. Good evening, Professor Gumede. It's a pleasure to have you with us tonight. Firstly, I mean, government has a whole ministerial advisory committee that it's working with. Why did you feel the need as independent academics to take that work and scrutinize it on an academic level?
No, thank you for having me. No, it is very important, that academics, civil society, and ordinary citizens do review and evaluate, the government management of society and so on. So it's very important. Remember, this is the biggest crisis of our lifetime, our generation, and so on. So it really is important that we play oversight over the way government is performing, what government is doing. So really, it is coming from that, but it's also making a recommendation on how to do it better, because, the crisis is not over. It's just about to reach its peak, and really, it is good that we evaluate the early management phase so that it can help us through when the peak comes.
What was the starting point of this research?
The starting point of the research was looking at the early phase. We call it the first phase of, government's response. And the early phase, was very, very good. You just think about it. Government brought in outside expertise, which was very important because before this crisis, government almost rarely used outside expertise. Secondly, government used evidence-based policy, which is very important. In a crisis, one cannot make decisions on ideology, on wishful thinking. One has to use evidence. So that was really important at the beginning. Then thirdly, government communicated with society. The president on a regular basis in the early phase told the nation what is happening, why are decisions being made, and so on. And then also the partnership at the beginning, where government partnered with business, civil society, with citizens, with communities, not only to deliver, but also in its communication. So these were really four big, pillars of government's early management of the disease strategy.
Sure, and of course, from the onset, they seem to have been, the position seemed to have been stronger in the beginning, but as the months progressed, we began to see certain gaps expose themselves. And I wonder, how does this kind of research, how is it conducted without necessarily having full details of what's happening behind the scenes and having full access to some of what is informing government's decisions right now? Because even though we've been told some things in the public, there certainly hasn't been full transparency.
No, absolutely. You are right, but one can do research without knowing, the minute detail in the background. And so on. So that is quite important to say that. I think so. What went, some of the lessons for us really from the government's first phase is, the government must communicate its decisions to citizens. And secondly, decisions must be made on evidence-based level and rational, common sense decisions. We've seen in the second phase, the lockdown level 4, lockdown level 3. Remember, there was a debate about alcohol and tobacco, whether that could be sold. So, there was a classic case of government not explaining properly to citizens why did they take the decision. Was the decision rational? Was it evidence-based? Was it common sense? So that immediately, was some of the things that we pointed out for government to go forward to say, well, actually, make decisions on a rational basis and explain it in a way that people can understand it. And then also the other weakness into the second phase of the government's implementation was that, there were little, partnerships were beginning to be reduced. I mean, we haven't seen a partnership between a private sector and the public health sector. because, we cannot deal with this disease unless there's a partnership that we pool the resources of the public sector and the private sector. There's the government on its own. This crisis is so big on its own cannot do it alone. So it's going to be really important as we go forward that there's a partnership, in the health sector, the public and the private, but also outside the health sector in the economy between business, civil society, communities and government.
Did you find instances where government did things right? And I'll point you to this issue of flattening the curve. We were told at the onset of this lockdown that the aim was to flatten the curve. Now, there are big questions from people who ask, well, what does a flattened curve look like? Because we're still reaching a peak, and many would have thought that flattening the curve would mean reducing that peak somewhat, and we're subsequently told that that is not the case. So where does one measure the success rate of the intervention?
So one measures, I think there are two key levels that one really have to measure. In terms of what government managed was successful in slowing down, the initial, rate of increase in order to give the government the space, to get capacity, on stream. Because, in the beginning, in South Africa, we didn't have the capacity. We didn't have the ICU units in the hospital, we didn't have the testing equipment and so on, and we were not coordinated enough. So, what a lockdown did early on was to give government room to maneuver, to build up the capacity, to mobilize expertise and skills and so on. So that's the success story. Unfortunately, things a little bit, went a bit uneven thereafter, because what we should have then done is government should have then prepared. And when I say prepare, what does it mean to prepare? Firstly, is government should have then pooled during that period, pool the public and private sector resources together. So when the peak comes, then everyone is ready and so on. The second thing also what government should have done during that period, it gets difficult. Our society is unequal, which means that social distancing, for example, in the townships, in the informal settlements, in the public schools, in the transports, in the taxis, we should have then had a plan, how to do that.
Sure.
And the plan was supposed to be ready.
I'm very keen to explore a bit further on this issue of private-public partnerships that you think needed to take place, because we've seen business be at the forefront of saying we are intervening in this way. They've given money for PPE, they've helped procure ventilators, etc., etc. So are you saying that even though that seemed to happen in business, it didn't translate itself into the health sector where perhaps it's needed the most?
Yes, it is happening, but it is not happening. This crisis is so big that we cannot do piecemeal partnerships. Partnership has to be in a big way, in a way we've never seen so far in our country. I'll give you an example. The unemployment insurance fund right now is, one of the pillars of the government's response. A lot of people are getting unemployed and they need the money like yesterday. They need it immediately. Unfortunately, the unemployment insurance fund, like many state-owned entities, doesn't have the capacity, doesn't have the resources. Now, there we would want to see that the private sector partner with the unemployment insurance fund to say, well, can we help you with the technology? Can we help you, to deliver the money to people, who are desperate to get that money quickly? Unfortunately, as it appears, that the unemployment insurance fund was unenthusiastic to take business support. So, that really is a problem, because then it means people who've been waiting and want their money cannot get it on time because of lack of capacity, in the unemployment insurance fund, and the fact that the unemployment insurance doesn't want to accept the help from the private sector. So there's a failed public-private partnership, potential for success hasn't worked.
What happens next? You've put a lot of work into this document. What are you going to do with it?
No, the next thing is hoping to engage with governments, so the government can, take some of the lessons on board, because, we are now reaching the peak, and now we really need to bring all capacity in the country, every capacity in the country, every skilled individual, every business, every civil society organization, every community, every citizen with a means must now help, and the government must mobilize them and bring them on board, to help us deal with this crisis. So and then what we have to engage also, of course, with business. We have to engage with civil society, and we have to engage with communities also, because research is useless unless the communities also understand and they're part of the process.
Professor.